Dr. Steve Puckett. I'm a board-certified chiropractic neurologist, and today we're talking about carpal tunnel syndrome. Carpal tunnel syndrome is when you get pain and weakness, numb and tingling in your hands. Now, if it's true carpal tunnel syndrome, it's only going to be these three fingers. These two fingers are not involved in true carpal tunnel. I've had patients come in where they've got whole hand numbness and they've been told it's carpal tunnel. If it's the whole hand, then we've got multiple problems going on. And what happens very commonly when we get a pinched nerve here is that we also get pinched nerves here, here, here. It's called multiple crush syndrome, where you might have the exact same symptoms, but it's actually multiple causes instead of just the one. So now carpal tunnel, I want to describe a little bit about what this is. Right here in the wrist, there's a tunnel, and that tunnel is an arch like this over the back of the hand. Over the back of the hand. And then on the bottom side, there's a tendon, just a piece of gristle that goes right here, and then the nerve goes through this tunnel. So what I'm describing is right here, and then the nerve goes through that tunnel into the fingers. That's our carpal tunnel. When the arch stays nice and tall, the tendon is here, there's plenty of space for the nerve, everything's great. When we take our hand and we turn it over and we leave it that way 8 hours a day while we're working, if we're a mechanic and we're using our wrist all the time, these things can put a lot of extra stress on that. If that stress is not balanced, then the arch starts to fall. As the arch starts to fall, the space in here decreases. Now the nerve gets pinched. This is a classic pinched nerve. As that nerve gets pinched in here, that nerve comes up to these three fingers. Other nerves come over here, but the carpal nerve comes here, you get pain, numbness, tingling. Medical approach to this, they come in and they take this tendon that's causing all the compression here and they snip the tendon. It's called carpal tunnel surgery. They snip the tendon and now there's plenty of space again. So you're going to feel better. You're going to get the messages coming through, the pain, numbness, tingling goes away. Awesome, successful. The downside of this is that all of a sudden now you don't have the same stability in your wrist. You're not going to be as strong. You're going to have a tougher time opening jars. You're going to have a tougher time doing the activities day to day that you've been doing. So this is the downside of this. Now, I'm really happy to work with medical doctors and let them do what they do and I do what I do. But I'll tell you, this is a time when once you've had that tunnel snipped, there's no going back. So with this, come in and see if the conservative approach can work better for you. Now what that conservative approach means is that we're going to work to help increase the arch again. We're going to work the muscles so that they can get stabilized. And we're going to, most importantly, we're going to work the multiple crush problem that happens for most people. If you've got a pinched nerve here, you've almost always got a pinched nerve in other places. Multiple crush is very common, and that would account for a lot of the failed carpal tunnel surgeries. So this is the alternative approach. It's really successful. It's very exciting to see people get their hands back, get the pain go away, and get their strength back. I hope this helps you understand what's going on.